Hello, I'm Kim Holden, and I am here with Vicki Dufresne, who is the director of the Louisiana Senior Health Insurance Information Program, which is also known as SHIP. Thanks so much for being here today.
Well, thank you.
We are talking today about these senior health counselors who provide guidance to people who are already on Medicare or who are about to qualify for Medicare for the first time. Those people approaching that age of 65. I know a lot of people who are approaching that age, getting ready to qualify. They can be a bit nervous about what this entails. They don't know really how to go about enrolling in the right plan for their individual needs. So I guess just tell me what SHIP counselors do for these individuals that they may not be able to find elsewhere.
So in Louisiana, we have the program, the SHIP program, and we have Louisiana-based certified Medicare counselors that work in our office. We're housed at the Department of Insurance, so we know the laws and the rules and the regulations for the state, as well as knowing Medicare. And so what we are going to do when you call our office is give you free, unbiased information. So we're not going to be an insurance agent trying to sell you a product that you may or may not need. We are not the infomercials that you see on TV or the robocalls that you receive, but we are telling you what is going on in the state of Louisiana and what is available to you as a Medicare beneficiary in Louisiana. You get all those phone calls, you get all that mail. We're going to try to help you figure out what's garbage and what's actually information that you need to know.
And not just that, I'm guessing that the rules change over the years. The laws may change. There may be updates to the different programs, probably more than we even need to know. And so that's important that the Louisiana residents have really good training.
Oh, yes, yes. And so, insurance changes every year, whether you're working or whether you're a Medicare beneficiary, your options are subject to change on a yearly basis. So our counselors across the state go through rigorous training to make sure that they know what is available each year, when the changes are going to take place, and what is available to an individual that is turning 65, whether they're turning it this year or next year, kind of what they're going to need to be looking at and looking forward to as they age or as they already may be 65.
And I noticed you said unbiased counselors, and basically the counselors aren't trying to sell you a program. Medicare does cost, but they're not trying to sell you on a program. So talk a little bit more about that.
So yes, Medicare does come with a premium every month, Part B as in boy, which works for the medical side. So all your doctor visits and labs, everyone pays a premium for that. And every year that premium changes. So our counselors are explaining to you what that's all about. They are also telling you, or I shouldn't say telling, explaining to you that there are types of insurance that can fill in because Medicare is not 100% coverage. There's an 80-20 split for the most part. So what is going to fill in that 20%? What's going to cover my prescriptions when I go to the drugstore? What's going to cover my doctor visits, my labs, my x-rays? And that's what the counselors are there to try to help you understand. Here's what's available to you, and here's how you can go out and get that insurance. We're not licensed agents, so we're not selling you on a product.
And you're not recommending a certain type of insurance or a certain insurance company.
Correct. I mean, we'll give you options. We'll talk about different companies. I'm a very visual person. So when we built our house, I needed to be in a room that was 10 by 10. So I know, that's a perfect size for the bedroom. And so that's kind of what we do. It's like, okay, you see this insurance company having a commercial on TV. What does that mean? We're going to tell you or explain to you what that insurance is all about, how it all works, how it works with your A, how it works with your B, how it works with your D, which is your prescription coverage.
A lot of letters there can get a little confusing for people, for sure. And we do see a lot of messages on TV. We see a lot of commercials or even infomercials, and it seems like they come at certain times of year. Those are through Medicare, or those are separate? I mean, how much should we trust what we see on television in terms of those commercials?
Well, typically, if it's a commercial for Medicare, your biggest time to see it is October 5th, the first part of October. through December. October 15th through December 7th is the Medicare annual enrollment. So that's when a person on Medicare can make a change to certain types of insurance that they may have, especially their prescription drug benefit. They can change that during that time period. So you'll see commercials and you'll see the symbol on there that says the Centers for Medicare and Medicaid Services. Otherwise, like right now, I know there's a station that runs on my TV that's an infomercial from an insurance company. And they're talking about a type of Medicare insurance that that company sells, but it's just a commercial. It's just, here's what we have to offer you.
This is not Medicare saying.
It's not Medicare
this is your
saying,
option.
it's the insurance carrier saying, hey, we have this product for you, come join it. It's got lots of good benefits for it.
So it's better to get with a SHIP counselor who is going to give you your options and tell you what you should be looking for, to do your research rather than just take what you see with a grain of salt from the television as, oh, this is what I need.
If you're calling that number that you see on TV, 9 out of 10 times they're talking about one specific carrier. When you call our office, we're going to talk about all the carriers that are available to you based on where you live.
And what's the downfall of just hook, line, and sinker going for one of those commercials or infomercials? What could be the risk to the Medicare recipient by going with the wrong insurance company or plan?
Well, for some, you're locked in for an entire year. Your doctors are not in the network. Your prescriptions are not covered by that particular plan. Or your prescriptions may be covered, but your pharmacy's not. So you're using an out-of-network benefit. So your costs are going to be a lot higher. So for some people, calling one company or one phone number and getting just one thing is kind of like buying, I only eat cheeseburgers from one particular place, although somebody else may have really good ones. I'm losing out on what benefits may be available to me by not looking at the big picture.
So for somebody who goes to a SHIP counselor and says, okay, these are my doctors, these are the drugs I take, these are the specialists I see, can that SHIP counselor say, okay, well, this is going to be the best plan for you based on what would be in-network versus out-of-network?
So what we would do is take that information, put it into Medicare.gov, especially their medications, and get a list of plans that are available to them. And then the other piece of homework that we encourage the consumer, the beneficiary, to do is ask their doctor, what health insurance plans, what Medicare Advantage plans, what Medicare supplement plans does your office accept? And from that, we can kind of help them narrow down their options. I mean, we have 6 carriers within the state that offer a multitude of plans. So Dr. Smith may only take 3 insurance products, but Dr. Sue over here may take all 6 carriers. So it's kind of trying to figure out what's the best option for you, but at the same time, ensuring that the doctors are in the network, ensuring that the medications are covered, and that their copays are as necessary and as limited as possible.
It's a lot of homework that needs to be done before
Yes.
you make these decisions. And so how important is it for people to get a jump start?
Very, very important, because it's not something that we can do in a 5-minute conversation with them. So, to apply for Medicare, your initial enrollment is a 7-month window, 3 months before, the month of, and 3 months after. If you work past 65 and you're using your special enrollment, you have an 8-month window there. And then you also have a general enrollment, which is January, February, and March of every year. So if you think that you're going to becoming Medicare eligible, or you're helping a loved one or a friend or a family member, it is very important that you start this process, if possible, 30 days in advance to kind of give yourself some leeway, because you got to make some decisions that are going to impact you for the rest of your life.
Absolutely, absolutely. Well, it sounds like you can trust SHIP counselors to give you that unbiased resource and just try to find the specific individual plan that's just going to fit your needs, what is the best way for people to reach out to actually talk to a SHIP counselor?
The best way to reach us is via the phone, 1-800-259-5300, option 2. They can go to our website at www.ldi.la.gov, and there's a consumer tab, and you can find SHIP. Our phone number is also on the back of every Medicare and You book distributed in the state of Louisiana. So we are legitimate. We got some validation there. And then we're out and about across the state. So they are welcome to, check our website for outreach events or wherever we might be, or even our local counselors that may be in a little rural area that we may not be in at that particular time.
And do people tend to do better with a one-on-one sit down in person with a counselor meeting?
Yes, and they can come to our office. As I said, we're downtown Baton Rouge, but we do have counselors across the state, so it may be better for them to, come to our office and meet with us, or go to, say I live in Shreveport, for example, and I might need to go to the office up in Shreveport at the Caddo Council on Aging. So it's a good idea.
Okay, and don't wait. Don't wait too late.
Yes.
It doesn't happen overnight. Thank you. Vicki Dufresne, Louisiana Department of Insurance, the Louisiana Department of Insurance. Help me with the SHIP, Senior Health Insurance Information Program. Yes, thank you so much.
Thank you.